My name is Antover Tuliao. I am an assistant professor in the Addiction Disorders and Recovery Sciences in the Department of Community, Family, and Addiction Sciences. I am also the director of the Center for Addiction and Recovery Research here at Texas Tech. So my academic background is I have a Ph.D. in clinical psychology from the University of Nebraska, Lincoln. I also have a minor in quantitative methods. I'm also a licensed psychologist here in the state of Texas. I also have a master's degree in clinical psychology, which I also got from the University of Nebraska, Lincoln, and a master's degree in counseling psychology, which I got from the Ateneo de Manila University in the Philippines. I also have a bachelor's in psychology from Ateneo de Manila University. So obviously I am from the Philippines and I moved here to pursue my graduate studies in 2011. So my area of research, I have two broad questions or problems that I'm trying to answer. The first one, I am trying to answer or address the problem of harm related to substance use. So I'm leaning towards more of a harm reduction perspective. So one of the problems that we have with substance use is all the concomitant or all the associated problems associated with it, right? So part of the things that I research is what are the things that lead to those harms that people engage in when they are imbibing the substances, and how can we reduce it? So some of the areas that I'm looking at is, reducing sexual assault perpetration and victimization in the context of drinking, and I'm looking at it really from a decision-making perspective, basically how to improve the decision-making of individuals when they are intoxicated. So that's my first problem that I'm trying to address. The second problem that I'm trying to address is basically how do we improve access of substance abuse treatment among those people who need it. One of the problems that we have right now in the treatment arena is that there's a gap between those people who need a substance use treatment and those people who access those treatment. So one of my research that I'm trying to get, or one of the answers that I'm trying to get at, is what are those barriers that prevent them from seeking help? How do we encourage them to seek help? And how do we close that barrier or that gap so that more people can really access treatment? So the classes that I typically teach are, it's an introductory course to addictive behaviors. It's really introducing students to what addiction is, how do we diagnose it, what are the predictors of it, contextual factors, legal issues, and whatnot. And it's really geared towards undergraduates and more of an introductory course. I also teach family dynamics of addiction and recovery. At the graduate level, I teach the issues of addiction and recovery, which is more of an in-depth look into addiction sciences. It's broad, but at the same time also, we cover different aspects of substance abuse and addictive behaviors, but at the same time it's geared for more graduate student audience. Undergraduate and graduate students are very much welcome in my lab. We welcome them and we treasure them really, because we feel that they play a big role in the research that we are doing. And undergraduate students can definitely come in and help out with the graduate students, and they can be part with the entire research enterprise, starting from collecting the related literature all the way to running experiments and helping the graduate students produce their manuscripts or their publications. Graduate students, absolutely, we welcome them as well. So, and I try to cater for the graduate students. I try to cater the research that they will be involved in, depending on what their career trajectory is like. So I try to tailor fit their training and what they do in my lab, depending on really what they want to do after they're done with their graduate studies.